No cases were reported in the migrant worker dorms today, but as a precaution after several cases were detected in the Westlight Woodlands dormitory, preemptive testing operations are being conducted across dormitories and work sites.
From last Friday to this Monday, over 5,500 workers were tested, including those from the worksite related to Westlight Woodlands' confirmed cases, as well as workers from other dorms who have come into contact with them. This preemptive operation also involves workers who have recovered and those who have never been infected, and is on top of the rostered routine testing regime.
Yesterday, the Health Ministry said that 24 recovered workers from the Westlight Woodlands dorm were found to be positive, although 2 of them were later determined to be negative after retesting.
5 of the 24 were also assessed to be likely cases of reinfection. 11 were assessed to be shedding virus fragments, and the remaining 6 cases are pending assessment.
Dr. Leong Hoe Nam, an infectious diseases specialist from the Rophi Clinic, joins us now. Doctor, welcome back. Doctor, what we're seeing with reinfected cases, they point to the grim reality that COVID-19 can never be completely eradicated. Now, this may come across as a little demoralizing, but is there a bright spot?
Very sad, isn't it? Think about it. COVID-19 now, COVID-19 again and again. It looks like people can get reinfected again and again and again. But I think there are saving grace. I think there is an opportunity otherwise. Number one, never before has science been so advanced that we can actually create a vaccine within a year. Number two, we have very effective vaccines now. It is about rolling out to all the countries and to all the people. Number three, we have means, we have the medical capability and technology to actually counter to this rapidly adapting virus. If all of us, everyone, every country were to work together with science, not against science, we can surely still win the war against COVID-19, at least relegate it into a common cold. The possibility is there, but the heart is weak.
Perhaps it's useful to know, Doctor, about post-vaccine reinfections. Are they unusual, or are they actually quite common in other infectious diseases?
I'd rather look at it another way. If you look at chickenpox, once you have had one chickenpox, you tend not to get chickenpox again. Yes, you may, but very rare. Measles, you tend to have it once. Influenza, the same influenza strain, you don't get it again. But COVID-19, it's a different story because the virus has adapted to actually avoid the immune blockage which the body would block. So in other words, you can be infected once and you can be infected again. And the way they do it is to change the goalposts. That's something I'm going to share with you. You see, the body learns to fight against a virus in a certain way. It's like a goalpost with soccer, we score straight into the goal. But the virus will mutate, and when it mutates, it literally shifts the goalpost from one place to another place. And all our immune system that's targeting the goalpost will now be less effective, which means winning against the virus is going to be more difficult, which means the virus can infect the individual again. Now, if the goalposts have been shifted once, can it shift again? Absolutely. So in turn, you can be shifting, and until you get infected again and again. So this will be the curse for humans for many, many decades to come.
Well, Doc, let's look to what's happening in the US. The Centers for Disease Control and Prevention announced that fully vaccinated Americans don't need to wear a mask when they're outdoors, either alone or in small groups.
Speaking to reporters on the White House grounds, US President Joe Biden echoed the CDC's guidelines.
Starting today, if you're fully vaccinated and you're outdoors, you need, and not in a big crowd, you no longer need to wear a mask. I want to be absolutely clear. If you're in a crowd, like a stadium or at a conference or a concert, you still need to wear a mask.
So if you actually look at the statement, if you're outdoors, alone, far away from everyone, the data is very clear. You're outdoor, you're alone, you're more than 2 meters away from anyone, no virus can come close to you. Number two, if you're outdoors, the constant breath of fresh air, you'll feel the wind in the hair. This is where the virus will stay out of you, stay out of your hair. Number three, small groups. Small groups, ideally, we're talking about if we're in the same family, it's fine because back at home, you're fine. I think this is a scientifically correct statement, but this statement is also to try to validate his 100-day mask, which President Biden wanted. 100 days in office, give me 100 days where everyone wear a mask. He's trying to keep up to his election promise. Number three, I think he's trying to cheer up the nation and to get everyone excited a bit again. But the point is still remains the same. If you're outdoors but with big crowds or with close people, you still need a mask. Things don't change. And I think President Biden is really smart to realize this. The threat of the double mutant in India is very real. It can come into the US and it can decimate the economy of USA very quickly at the snap of fingers. To actually have this statement outdoors on your own is a way to lift the spirit up, lift the spirit of America.
Right. Well, from the U.S. situation to Hong Kong, the city will be easing its COVID-19 rules as well. From tomorrow, certain establishments like bars, pubs, karaoke clubs can reopen if staff and customers have at least one dose of the vaccine and use Hong Kong's contact tracing app. So, Doctor, what do you make of this strategy, to relax measures based on the extent of vaccination?
I think it is a strategy that's based on economic terms rather than the vaccine terms. If you look at it, one shot of vaccine will only give you a little bit of antibodies. You really need 2 shots to have some protection against the wild type virus at least. If you want to overcome the double mutants of India, my dear friend, 2 shots can barely make it. In other words, they are putting their individuals at risk if you have 1 shot and you go out to the pubs. And let's be very realistic here. If you're at the pubs, you're drinking beer, your spirits go up and your mask comes down. Everyone's going to be cheering and spreading any potential virus there may be. So I think it may be rather short-sighted. Now, the saving grace in his line in the Hong Kong statement and plans are they are going to have a trace together app that's very similar. When you have this app of trying to trace the contacts, then in turn you can try to control secondary spread. However, I will still be cautious because we are now talking about a double mutant from India. Double mutant that can overcome the vaccine efforts which we have. And remember, the virus just wants us to be under this tyranny of repeated infections. If there are huge numbers coming up again in Hong Kong, our projected bubble between Singapore and Hong Kong may just burst yet again. So I'll be very cautious. I'll be watching that space on Hong Kong.
Well, it's always a pleasure to speak with you, Dr. Leong. That was infectious diseases specialist Dr. Leong Hoe Nam from the Rophi Clinic at Mount Elizabeth Novena.